So I hurt my hamstring the other day.
What were you doing?
I was running. Someone programmed 200 meter.
I'm not responsible for this injury.
She did this. I had to run 200 meters multiple times, with the 200 meters getting faster and the time for recovery being shorter with every 200 meters that I ran. I got 4 laps in, and out of like seemingly nowhere, I pulled my right hamstring. So we thought that it'd be a good idea to go over what we would tell you to do. And I have the honor of being a patient since I hurt myself, and Chloe...
Unwilling patient.
No, only for Chloe. So Chloe gets to do the thing that she's been waiting to do,
Yes.
which is tell me what to do for my hamstring.
You did consent to this.
I did.
Okay.
Yeah, so we're gonna go over how one could fix their hamstring. I'm trying to run it in a specific time. I've been working hard for a while. I have a specific date in mind that we're gonna time trial at Lehigh University. I'm hoping to get better as fast as possible. I'll be playing the role of the runner patient, which means like, I'm not gonna stop even if you tell me.
No, I'm not telling you to stop.
I need it to be better right away.
Okay. We can make that happen with some time and consistency.
Oh, that sounds boring. All right, but
But with some of these simple things you can do at home, you can speed up the recovery process. A lot of times, people will talk about how hamstring strains take a really long time to recover. I was just talking to a patient about this, and they were saying they're like, "Oh, well, you know, hamstring strains, they take a really long time because your risk of re-straining is like pretty high." But it's in part just because they're just really not treated that well. You have to do something aside from just resting in order to help to facilitate that healing process of the muscle, so then you can get back to doing what it is you want to do.
Right, and we're going to show you something very actionable. Actually, I've been doing most of this already, and I'm already running just a handful of days into it, hoping to get back to sprinting full speed shortly thereafter. And it was a pretty nasty pull. I mean...
Why don't you talk about what happened? John's been doing these speed workouts. It's not like, oh, he's gone from not doing anything to now all of a sudden he's doing something, which is a little bit more classically how someone strains their hamstring. You know, they're playing like at a company softball game or something like that, and they pull their hamstring. That one's pretty obvious, right? Like, you're not really that warmed up. John has been doing these speed workouts, and he warmed up in the way that he almost always typically does. So then, you know, it's a little bit of kind of trying to figure out like, well, okay, well, why did this happen?
I think what Chloe wants me to say is...
Why did it happen, John?
There were a few things that were different that day. It was much colder than it had been.
Yeah, it was like the first cold day. It was like low 50s when we started.
Normally when John and myself, when we're warming up, we have more time into the warm-up. With this, I was getting into a faster pace even more quickly than I typically do. So normally like we have like more like gradual increases, whereas I was kind of gunning it. And also my form fell apart. I sort of got backwards and I overreached with my right leg. I overstrided and I like hit my heel with my body behind my leg, and I pulled through hard with my hamstring, and it was cold and I was moving quickly, so it pulled. So I had like a form breakdown and it was colder. I think it's important to say, sometimes it's not your fault. It's just, you know, you could do everything right, but you're doing something physical and sometimes you hurt. And in my case, maybe I did a few things wrong and maybe I did something, but maybe it just happened and I just need to make some simple changes and corrections and get past it.
All right, well, let's get into it. So we're going to use 3 different techniques today. So the 3 different techniques that we're going to do, we are going to do tack and floss. We're also going to use a sidekick tool, but you know, any type of like instrument-assisted soft tissue mobilization tool.
Muscle scraping.
Muscle scraping.
Muscle scraping.
Yeah, leave it to me. And also we're going to do some soft tissue mobilization with the lacrosse ball.
And actually we're using a field hockey ball in this case.
Oh yeah, I do like the field hockey ball.
All right, it's a little bit bigger, it's a little harder, it's a little more painful, which explains why Chloe's happier about this. But any kind of ball will do, except if you use a tennis ball, it'd probably be too soft, and a golf ball will be way too small. So like usually like a lacrosse ball, field hockey ball, at your local Dick's Sporting Goods, you can find a million of them.
Yeah. So we're actually going to start with first using the field hockey ball. Now, John's been able to isolate kind of where exactly he strained it. The thing though is that I want you guys to work through the entire hamstring, right? Because by going through the entire hamstring, you're actually going to get the benefit of loosening up that whole muscle and aiding in the recovery of that strained area. So you're going to place the ball underneath the hamstring. You want to have like some type of system. So John's going to actually start a little bit higher, kind of up toward his glute. Yep, so he's gonna place that, place the ball down, and now he's gonna try to sit as upright as he can. So we want to try to stretch that muscle in a functional position. So he's gonna try to sit as upright as he can. Good. And then he's going to start to try to begin to straighten his knee. So he might not be able to fully straighten it. That's totally fine. You're just looking toward just getting it to move a little bit better. He's gonna do like 5 to 10 times in one area. Then you're gonna work your way down.
Right, okay. So we'll say I did 5.
Okay.
Now I'm gonna come a little lower. It's just easier since I'm up here to use my hand. I'm following along that line, sitting upright, straight, and bend. And it feels painful. Uncomfortable is what I say when it's someone else. It feels painful when it's me.
Now, the thing though is that like, you're also not trying to re-injure yourself, right?
No,
so
yeah,
it's like, that's why we're doing this in a dynamic way. So all of these things that we're going to do are going to be dynamic because we're just starting to introduce a little bit of range to that area. We don't want to like try to force it into doing anything that it's actually not really that ready to do. Yeah. So it's just going to be this active motion back and forth.
Right, and when I say painful, it feels like a good massage kind of feeling. Like if you were like, oh yeah, it hurts so good kind of feeling. That's really what I mean. And make sure, like, I have the ball more towards the outside of my hamstring at the moment because that is where I feel it, more towards like my outside hamstring, IT band almost. So if you only follow along one path, you might miss like the painful spot. So make sure you explore a little bit with the ball because you also might surprise yourself with where you feel it because you think it's going to be somewhere and often it might actually be a little to the left, right, up or down.
Yeah, there are 3 hamstring muscles, and actually sometimes too the thing that people strain is actually one of their adductor muscles, what we typically think of as the groin. So keep in mind that it's helpful to go through that entire area.
Yeah. So I went through, I did 1 round from start to finish, sat upright, 5 to 10 on each one, and applied as much pressure as I could.
Good.
What do you got next?
Okay, next thing we're going to do is we are going to use the muscle scraper.
So, am I using it or are you using it?
You're going to use it.
Can I have
Do you
it?
want me to show you how to use it?
How do you want me to lay?
Because John's going to be doing this himself, he's going to be lying on his back.
Okay.
You're going to hold here. Okay. We're going to introduce a little bit more range of motion to this area, and John's going to scrape the muscle as he bends and straightens the knee. Okay. Or moves towards straightening it. So John's using the scraper tool like at an angle, and he's just working in kind of like a 2-inch area, 2 to 3 inch area, just going back and forth as he bends and straightens the knee. He's going throughout that entire hamstring muscle as opposed to just in that one area that hurts. You want to avoid any bone as well.
Right, and so I'm covering as much as I can of my leg. I am focusing a little bit more towards where it hurts. Pro tip for this is I'm wearing compression pants underneath. Usually if you're going on bare skin, you're going to use some kind of like emollient or gel, like Aquaphor or Sidekick provides its own proprietary gel. But if you have compression pants on, you just go over top of it. And in case you're wondering, these are Pandas.
So you want to try to go through that entire area for about like 2 minutes or so. You can spend a little bit longer in certain areas. How's it feeling as you
Pretty
go
good.
through it?
Yeah, this is not so bad.
Okay, good. The other thing that John's trying to focus on is making sure that he's not rounding his back. So
I'm
he
not.
needs
Nice
a
try.
little bit of an arch through his
Chloe's
back.
like, it's not hurting enough. Something's wrong.
No, I'm more so just...
Where's the agony I was promised?
John, don't you want to get better?
I do want to get better.
Okay, then you need to do a slight arch
Dr.
on your back.
Costigan. No, I don't.
Yeah, you want a slight arch
Oh,
on
I
your
want
back.
a slight arch in my back.
Yes.
I wasn't listening.
Yeah, exactly. He was flattening his back. I know that he was. You need a slight arch in your back because that's how you're going to stretch your hamstring. You know that.
Yeah, I do know that.
Okay.
I think it's self-preservation.
John, stay tuned for the anatomy lesson that's going to correspond with the with the self-treatment.
All right, so I have a slight arch in my back.
Yes.
Straightening, I'm bending. I definitely covered more than 2 minutes at this point.
Yeah, definitely.
All right, so what do we have next?
Okay, last thing, we are going to use the tack and floss.
All right, so now we have tack and floss, which is a technique that we've made other videos on, also for the hamstring. And in this case, we're showing it in a combination of 3 different ways of treating.
And these will be in order of like how challenging they are.
Right, yeah, and so stick with the order that we're going through, at least to start, so that way you can feel what it's like to have this specific order. So for the tack and floss.
For the tack and floss, this is like a thick piece of rubber that like totally unwinds. What you're gonna do is you're gonna wrap tightly, pretty tightly, it's gonna be pretty uncomfortable, around the muscle in about like a 4-inch area or so. So John's gonna anchor it and then he's going to pull. John, you're gonna pull?
Oh,
it has to be pretty tight.
Yeah, so I like to overlap it first, so that way I can anchor it. Chloe's going straight for the kill shot right away. All right, so now I can pull whatever I want, it doesn't matter. So I started closer to my knee, but I'm gonna work my way up my thigh here, covering all the pandas.
Just like a 4-inch area.
Okay, so
then you're gonna get some overlap.
All right.
Here we go.
In this case, I'm just gonna apply some pressure with my hand to keep the band down. And then
John's going to do the same bending and straightening that he did when he was using the field hockey ball too. So you're just going to bend and straighten 10 times or so. You'll know that you have enough pressure when it feels like it's going to feel pretty uncomfortable, but it's not going to be though so uncomfortable that then your foot's turning blue in a matter of a few seconds.
But if you have it tight enough and you have it on there for about a minute, you might actually see your foot turn blue.
Yeah.
And that's okay, but when you get to that point, you definitely want to take the band off.
Yes.
So let's say I did 10, and I can feel my leg getting tired too is the other part. You'll feel it fatiguing.
Good.
I'm gonna
take that off.
And then when I'm taking this off, what I'm feeling is this sense of warmth, this warm sensation through my leg, and that is blood rushing back in. You want to do it? That is blood rushing back in after you've removed the restriction. That is what you want. That is part of what makes it oh so good.
All right, next position. You're gonna lie on your back for me.
Okay.
So now we're gonna do the same thing. So we're gonna be in that 90-90 position. So just like this.
For ease of use, and so that way I can satisfy Chloe's desire here. She's gonna wrap it for me. You still could wrap it yourself.
Yeah.
It's arguably easier.
No, it's not.
But I think she just wants to torment me.
No, I know exactly where he needs to do this. So.
Yes.
Okay.
As my doctor or my wife?
A little bit of both. All right. Now, you're gonna straighten this knee and bend it. Good. So now if you see from like the beginning of the video to now, there's a lot less restriction in terms of how much she's able to straighten that knee. The thing that's really cool about the tack and floss is if you have a nagging hamstring injury and like it feels like every time you go to straighten it, it really pulls, this tack and floss is a total game changer.
Yeah, I mean, this will be one of the fastest ways you can make a difference for a lot of your soft tissue injuries.
Yeah.
Got 10 in there.
10. Last position.
All right. And again, this is from easiest to hardest in terms of positions also. All right, so this is the third and final way that we're gonna be tack and flossing, and as well as tack and floss being the third and final way that we're treating the hamstring injury.
This is where it's going to be really important to really make sure that you're ultra specific about the position that your spine is in. So you want to try to get an anterior rotation, so a little bit of an arch in your lower back. That's going to kind of challenge a little bit more of that hamstring flexibility. So John's wrapping it in the same fashion that he did before. So it's like that 4-inch band or so. It's going to be pretty tight, like kind of uncomfortable. And then what he's going to do is he'll have this stool in front of him just so then he can comfortably place his hands or his forearms down on the stool. So then that way he'll have something to kind of like lean against when he goes to bend and straighten his knee. Now, the big thing that I really want him to focus on is making sure that he has a little bit of an arch through his back. So There you go. So what he's going to try to do, maintaining this arch in his back, and then also both sides of his hips have to be pointing forward. So what happens is, especially if you're tight, this side will kind of start to like come forward. So we want to make sure that we pull this part of the hip back, and then he's going to bend and straighten that knee. As he's doing that, he's not shifting his whole body back. He's just thinking about that femur is coming back. He's also making sure that his pelvis is staying over his foot.
Also, the lower you go, the more you'll feel it. So if I could get to the ground, it's much harder here.
This is not a good position for John though, because then he loses the position
Right.
in his lower back.
Right, I'm not there yet, but
No.
if I would lower the stool, I could get lower, or I could just let my head further down. But you might find if you are just naturally more flexible, you might have to get further to the ground to be able to feel
Right.
this.
Yeah, and the inverse is true too. So like you might actually have to be way up on your hands and not really bending over at all, because sometimes too when people have like chronically tight hamstrings, then it's really hard for them to maintain this this flat back position.
All right, so I'm gonna take it out from here. Again, same idea. I feel warmth coming back to my legs, and I feel like that blood flow circulating back down.
You want to do this 10 times in a single wrap position, but then you can kind of work up your legs. So you might want to do like 3 different areas for a total of like 10 to 15 repetitions.
We showed them using the ball, we showed them using the muscle scraping, and this. How many times through those 3?
I would do about 3 times or so if you can tolerate it. I also like the idea of going through and kind of that circuit, because what happens is you'll notice that one helps the other. So by doing the ball first and then moving to the scraper, then to the tack and floss, the next time you come back around to the ball, it's already going to be a little bit easier and you're going to be able to get a little more out of it. So I suggest that John does this like pre-run, because it's going to kind of get him ready to be able to actually run, because right now that hamstring length isn't sufficient to really be able to run.
Right, and then generally speaking, for anyone, do it before the activity.
Yeah, if you're dealing with this strain.
And if you're not doing anything that day, at least get it in at some point of your day.
Yes. Why are these questions so leading?
That's all, I'm just saying what I want to hear.
Yeah.
But you should do it at least once every day, but you could do it maybe 3 times. Would you agree? Like 3 times in a day going through this, especially when you need it more, and especially if you find that you're responding well to it.
Yeah. And the other thing too is that the reason why we're doing this in a dynamic way is because you're just introducing some range into that area. So these things aren't designed to be like held as like long hold stretching or anything like that, because what we're trying to do is we're trying to make sure that that muscle can contract and relax the way that it's supposed to.
Right, and you should anticipate seeing results pretty quickly, if not immediately, but certainly within like a 2-week period, you should be measurably better, maybe like as much as like 80% better in 2 weeks, closer to 100% in 3 weeks. And if you're not getting better, you should definitely reach out to someone, and if you don't have anyone, us at Mobility Doc, and we'd be happy to consult with you on maybe a more specific protocol for yourself.